ASAP so that your system doesn't get messed up. Because as you know that injuries they pile on one on top of the other. You're on mute, Kashyap.
So what you're suggesting is, of course, two things, right? One, get into the rhythm of training by having at least short, consistent runs, even if it's okay if the mileage is a little low. At the same time, if there is a persistent injury which you have experienced in the past and it is kind of still niggling you, then get that addressed now and not really wait for that injury to accentuate. Fair point.
Correct.
Now, when we train almost 4 days a week and a lot of us also try to do strength training once or twice a week.
Sure.
How important is recovery and how do we get more efficient at it, right? Because all of us, apart from training, have a professional life, have some kind of family life commitments, so and trying to balance and bring in a lot more time and effort required for training for comrades. How do we ensure that we get more efficient at recovery?
Excellent question. I love this question. Thank you for asking that, because recovery is one of my favorite topics and it's just not done enough, I feel. The focus on mileage is so high sometimes, and following the training plan is so high that, say, you've missed one training day, runners will make sure that they make up for it on another day, but they may not make up the recovery or they'll not make up on the strength, right? That is my problem with runners, that they forget that all this also needs equal focus along with the mileage. And this is the best time to work on that part. So when I say about recovery, being efficient at it, finding enough time for it is definitely somewhat challenging for professionals who are also doing comrades. It's a lot of time because the sheer mileage is so much that many hours you need to remove from your 24 hours of the day. Na? So recovery, may you do want to make sure your sleep is enough. So for comrades runners, social life to goes for a toss. You have no time for social life. That life you have to basically put into your training or put it into your recovery. I know that runners will say कि रात को टीवी देखते वक्त foam rolling चालू है या stretching चालू है. That's a common thing and that should be done every single day, especially the day that you have run. If there is time, you want to do foam rolling right away as you come back from home. Within the first hour is ideal. But say you do not get time to do foam rolling on the same day in the same hour, then do not sleep that night before you finish foam rolling. So before you go to bed the same day of the run, make sure you're doing some recovery stuff such as foam rolling, stretching, sports massage, things like that.
So you're suggesting, like, if I'm training 4 days a week, running 4 days a week, and on all those 4 days in the evenings, if not in the mornings, I should do some 10-15 minutes of foam rolling.
Yes.
Foam rolling or stretching before going to bed.
No, it's both.
Foam rolling and stretching before going to bed.
Stretching.
Wow.
Foam rolling first and stretching later. So if you get good at doing this, so it only takes practice. Now, like everything else, running also is, you get better at it with practice. The foam rolling, people who do consistent foam rolling and stretching, you foam roll your glute, you stretch your glute. You foam roll your hamstring, you stretch your hamstring. You foam roll your calf, you stretch your calf. Okay, so if you do it enough, you can get this in 10 minutes flat. Okay. And that's not a hard ask, right? Okay. And the reason for that is running is so repetitive. You're using the same muscles and the same muscles are getting tighter and tighter and tighter, and the myofascia is getting tighter. The muscles are getting tighter. The joints are getting loaded quite a bit, right? The more frequently you do that. So if you don't release or recover those muscles, the joint pay impact and the load keeps increasing with time. You want to make sure that your muscles are supple enough so the joints are not getting loaded, so that your next day ka run is fresh, that your joint is not going to get impacted as much. That's the reasoning for the foam rolling.
And is this because we are doing a lot of mileage? or you would
Yes.
even recommend this for someone who's training for a full or someone who's training for a half?
So my advice to full marathoners is along the same line. The long day, so the long run day, which is a Sunday or a Saturday, whichever one they pick, that day to foam rolling, they have to do about 20 minutes without fail post their running. And one day in the week, say a midweek, uh, the day they do strength training, probably they can add in a foam rolling. For the half marathoners, generally one day a week chal jata hai.
Understood. And fair, you also mentioned sleep, right?
Sleep.
Enough sleep. How much is enough?
Also a good question, very individual. I know people who survive on 4 hours of sleep, but I wouldn't say that's very healthy. Science does tell us that 7 to 8 hours is quite critical because of the stages of sleep that we need to get into, right? The REM and so all those stages are very important. If we miss out on those, it can have a chemical imbalance in the brain that can affect the body. So also that will affect your hormones, it will affect your muscles as well, joints, bones and muscles. So 7 to 8 hours is standard. We know that. The problem is when you have to get up early in the morning and train. So then have you made provision to sleep earlier on the days before? That is something that needs to be thought about.
Yeah. But yeah, I mean, I think most of us land up somewhere between 6 to 7. I really doubt people can manage 8 hours. But yeah, if they can, very good. But does sleep also plays as much a role in recovery, right? That is
Sleep is a big factor for recovery.
big.
Absolutely, it is. Our body repairs itself in sleep. When we are awake during the day, all organs are working continuously. It's only when we sleep that our body has a chance to recover and regenerate the cells. So if we don't give ourselves that time, then somewhere you've been shortchanged. So that part never actually gets repaired.
Hmm. Understood. Uh, how important, because we also briefly mentioned strength training, right? How important or necessary is strength training apart from the mileage that we put in?
Okay. Strength training is important for all runners. All runners know this. But from a comrade's perspective, you have to last a long time for ultras. The amount of time that your joints and muscles have to last is long, right? So there are two things to strength. There is muscle endurance and there is muscle power.
Hmm.
For comrades runners, your goal is to last the whole race and to do well without your muscles going into fatigue. Because the minute they go into fatigue, the injury pattern is going to start. And then once it starts, either a cramp will happen or, some niggle will start, and then it's tough to reverse that. So you want to prevent that from all aspects, and hence the strength training comes into play. Now, so this comrade is more of an up. Na? So
Uphill, yeah.
there is a difference between the up and down as far as muscles are concerned.
Hmm.
So for the up, you want to make sure that you're getting enough hill training in, because uphill, different muscles get used and downhill, different muscles get used. So
Hmm.
you must get enough of those hill training, but strength training for certain muscles focused is very important. So when you go uphill, your glutes, your quadriceps, and your calves, these are the muscles that need to have enough muscle strength so they don't fatigue out too
Hmm. Hmm.
quickly.
Hmm.
Okay, so focus must be on these muscles as compared to going down. Of course, you will be coming down to some extent, but it's not nearly as much as
Hmm.
going up. So even though joint impact will be less, because going down there is lot of impact on the joints, which is knees and ankles.
Hmm.
वो कम होगा, but muscle fatigue जल्दी होगा.
Hmm. 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 Hmm.
So for that, I would say focus on so think about it as glute ham, calf, so the whole posterior chain, and also your quad.
Mm-hmm. Understood. But clearly it is necessary. And the other point being, see, most distance runners, amateur distance runners like us are 40 plus. The average age is of course 40 plus, right? Is it true that uh, uh, we experience at our age muscle wearing faster or more, and hence strength training is more important for you now than it was earlier?
Yes. So we know that after 35, bones drastically start to drop. Bone mass starts to drop drastically. Muscle mass starts to drop for the age of 40, 42, right? So, and so if you were to do nothing before this, it would be okay before the age of 40, 42. But after 40, 42, weight training and strength training becomes quite crucial in the terms of your muscle tone is going to start reduce on its own.
Hmm.
Muscle bulk is going to start reducing on its own. And if along with that you have any comorbidities or a family history of, say, diabetes, you have more of an incidence of that anyway.
Mm-hmm. Yeah, so I think of course it's at our age it's become more and more necessary strength
To do
training
some
and
amount of strength training. And
yeah,
functional training is great, but lifting weights, using resistance bands, doing some form of resistance training is critical.
yeah. And then how important is or valuable is building core strength, right? Because of course largely we use our lower body while running, but then does how important is strengthening the core for
So when I
distance
say
running?
strength training, when I say strength training, core is a big part of it.
Okay.
So if you were to say a 45-minute strength training, you will spend 20, 25, 30 minutes doing core,
Okay. So as important, if not more.
if not more. And core may, yes, you do need to do ab work, but sometimes the focus on abs is so much that the glutes and the lower back get forgotten. So I would say you focus more on the glutes and the lower back, strengthen that, and the abs also do it, but don't do
Overdo it.
uh, so crunches. Yeah, crunches. Don't do
Yeah.
so many crunches. Focus more on the exercises lying on the tummy with resistance bands and things like that. But of course,
Understood.
gym is also an option. So
Yeah.
if you're doing that, then do a mix of both. Because the same exercises, if you keep doing, like a resistance band will train the muscle in the full length of the muscle, of the range of motion, as compared to machines which will train it in one. So it's
Hmm.
important to do a little bit of both.
Hmm. So, doctor, all that we spoke about so far, right, especially the strength training, the muscle wearing aspects, are they any different for a female runner, or are they, or largely the what we spoke about applies as much applies to a female runner as well?
Yeah. So for women runners, because the anatomy is a little bit different, when I say anatomy, the hip, um, the hip angle, the tibial angle is a little bit different, which means that women can be at risk for having knee pain a little bit earlier on if they don't focus on strength training. Also, hormones play a big role, right? So after 42, anyway, the hormones will start to change, which is okay. But the way that you will monitor and keep your hormones in check is by doing strength training. That's one of the major things that you can maintain those ups and downs. So for women, actually, strength training and resistance band training or weight training becomes more important than men.
Understood.
And in fact, for women, I would like to make one more point. I say that strength training is very important for women, but recovery is actually doubly important for women also
Hmm.
than men for physiological reasons. It just takes longer for a woman's body to get back to to recover the same muscles as it does a man because of hormone and various other changes.
Understood. Understood. Fair. Doctor, let's move to a bit on stretching, right? Most of us, by behavior, stretch a bit when we before we start and stretch a little more after we end, right? How important and necessary is stretching? Because there are different theories on this. Some people, some runners believe that stretching is necessary, important. Some runners believe that it's useless. Where do you stand on this one?
When I think about warm up, you're warming up not just your heart. You have to warm up your heart because you're doing endurance training, but you're using the muscles and joints in order to do that endurance training. So you have to warm up your musculoskeletal system also,
Mm.
which is your bones and your joints and your ligaments. All of those need to warm up. So I'm very much in the camp of yes for warm up and cool down. And there might be thousands of research things that say that this might be anecdotal, but I have seen too many injuries that come out of people not warming up enough or not cooling down enough. So I would say, why take a chance? Just do it,
Yeah,
no?
yeah. Agreed, absolutely. And yeah, that, as you precisely said, right? You don't realize when you're starting to get those injury or getting injury prone just because you've ignored stretching for 3, 4, 5 years, and then
Correct.
suddenly some injury creeps in, and the cause could be lack of stretching for 3, 4, 5
Absolutely.
years. Uh,
Absolutely. Because it's all a build up. No, nothing happens overnight.
yeah, correct. Absolutely. So let us, Doctor, also talk a bit about cramps, right? Because that seems to be a very common issue for distance runners
Yes.
and
Yes.
people. What are the reasons people cramp through a long run?
So, in my experience, I have treated a few runners for cramps alone over the years, and some have finished the Hell Race and the Comrades successfully without cramps over the last 2, 3 years. And there were some simple strategies that we had to eliminate. I had to figure out what is it that's causing the cramp. So, there are 3, 4 factors in that. One is could be, like you said, the warm up cool down is not enough. It could be the hydration. It could be just that they're dehydrated. It could be pacing. So, if say you have planned for a certain pace for X number of kilometers and you feel anxious that, oh my God, I'm not going to make it in time, and you suddenly change your pace, that is a reason for a cramp. You could be predisposed to tight calves. So there are a lot of runners who are predisposed to their calves are just very tight and they've never foam rolled, they've not got a sports massage done. So they don't know that there are trigger points sitting in each of these bellies of
Hmm.
the muscle. And if you don't get rid of that trigger point, then that muscle is basically inhibited. We say it's inhibited, which means that it's not able to perform to full capacity. Any muscle that has a trigger point, which is where we had to do dry needling. A lot of comrades runners hopefully know dry needling and taping. So we can do manual release and you can do foam rolling, but sometimes if you have too many trigger points in the calves, or if they are stubborn ones, and if you had a mother trigger point and it's given rise to baby trigger points, like sometimes there are several of them, then dry needling works really well to give you a quick fix so that you can get the calf muscle supple and then the cramp won't hit. But one of the important strategies that I have done for runners is for them to look at their electrolyte balance now. So this would be a good time to do that. In fact, I would suggest a blood um, get a blood analysis done and figure out where your D, your B12, all that is. But make sure that you check your serum electrolytes. Look at where your sodium, potassium, magnesium is. Look at those numbers. If it's deficient, then you have to make sure that you supplement. Talk to your GP, talk to your nutritionist, see what needs to happen. But some of these strategies, if you do now, like early on, before
Hmm.
the peak training hits, then I think cramps, you shouldn't wear cramps.
So what you're saying is there are different reasons why each different runner can get cramps. It is important
Yes,
to
yes,
diagnose what is causing you and
correct.
treat
You have
that.
to eliminate. Yeah, it's by elimination that you figure
There
out
is no
what.
one solution fits all approach in this one. Yeah. You also mentioned about massage and you kept referring to sports massage. How important is massage in the course of our training, and at what frequency should we do it?
Hmm. So, sports massage again forms a part of recovery, right? So, like I said, recovery is more important now. But right now, what are you recovering from? All the marathons and all the ultras and all the runs that you've done before you really get into your comrades training, that's what you need to recover from right now. So, my advice to most EMM runners was in the next 1 week, you get one sports massage done so that you have taken care of some of that stuff. But if you've not done that, now is still a good time to do it. But when you get into the peak training, then it becomes more important for you to either meet your physio and get sessions of dry needling and release work done, because your physio will know what your body tends to tighten. Like I know one of my runners, his ITB, थोड़ा भी mileage वो बढ़ाएगा तुरंत ITB tight हो जाएगा. So I know I have to keep releasing that कि it will support his training. The training is not going to stop. Now I have to make sure that he is able to train. So everybody has those little vulnerable areas. But a sports massage, if you're able to do, say, every 15 days, that would be ideal up until raised it.
Understood, understood. And you also mentioned about hydration, right? In your earlier response. So
Hmm.
how you say hydration? How do we ensure that we are adequately hydrating through this whole training period, whether it is on training days, long run days, or otherwise? How do we measure that, right? Because these are all, there are anecdotal numbers. Have 3 liters of water, 4 liters of water.
It doesn't work for everybody, no?
Yeah, pre-long runs have
Yeah.
ORSs, etc., etc. So, what do you think? What is your advice one should do?
So everybody here has done full marathons. You've
Yeah,
done some ultras.
yeah,
So you know the things that work for you already, correct? For first time comrades, people who are doing first time, I would suggest that you meet a sports nutritionist, because hydration and nutrition from the get go is important to streamline. Because when you get into peak training, you should know what is going to work on the day of race. और वो कभी समझेगा जब आपका लॉन्ग रन डे पे आप जब भी करोगे, तब भी you will have to mimic that hydration, and because it's lot of hours, so you will need a lot of variety of foods and drinks to have. So you can't just do कि अच्छा ठीक है मैं dates और ये चल रहा है मेरे लिए, that is going to work. You're not going to be able to sustain with that. You will have to figure out different foods that work for you, different varieties of foods for you, and that refine it by the time peak and towards the end. But like you said, there is no rule of thumb.
yeah.
No, there isn't. Every 45 minutes, if you feel like I know comrades runners जो बोलते हैं कि हम तो कुछ खाते पीते नहीं हैं." and we still finish. But I don't know how safe that would be. But like you said, there isn't a cookie
Mm,
cutter food for
yeah,
this.
sure. So, doctor, we spoke a lot about the physical aspects of everything, right? Uh, what about mental aspects? I mean, because uh, I have experienced that, and I've seen there is a bit of fatigue that creeps in. Come April, come May, especially, the temperature worsens. You have done so much mileage that you now want to figure out, yeah, there is injuries come in. So there is a mental fatigue that creeps in. Is there a way to condition it? Is there a way, do you kind of, what do you advise your runners?
So the physical aspect of conditioning your mind is to do everything you need to do now before peak training starts.
Okay.
Okay, because then you will be in a better frame of mind. You will know that I have done enough groundwork and foundation so that मेरा peak training बराबर हो जाएगा.
Hmm.
That's one. Secondly, you don't want to push your mileages more than is necessary right now. Wait a little bit. You do that taper tapering up, you do the gradual adaptation so that you don't get mental fatigue along with physical fatigue. The mental fatigue will happen when you do too much too quickly, and then at the end फिर लगता है अरे बाप रे अभी और एक महीना इतना कुछ करना है. That's when your mind starts playing with you. But if you have done low consistent mileages, your brain is adapting along with your joints and your muscles. So then the chances of mental fatigue doesn't happen quite as often. But
No.
of course, there are a lot of mental strategies that you can do. And I do work with a couple of sports psychologists. Of course, for amateur runners, don't think that it is necessary, but I do think that there is some value in that. And there are some great ones in Mumbai. So if you feel the need to get some strategies, reach out to somebody. There's no harm in, because like I say, to do a comrades or to do a marathon, it's not just you. You need a team to support you.
Yeah. Any sports psychologist you would refer names? I mean, if you can.
Yeah, I'll send it to you.
Okay. Okay. Fair. So, doctor, also as a on the day, right, on the race day, it's like a very long day, right?
Mm.
Everybody runs for almost 10 to 11 hours, some people 12 hours, and we also start the day 3 hours early, 3 to 4 hours early. Uh, what would you, I mean, for that day, is there something specific that you would advise runners?
For the day, obviously, you've heard this before. All marathon runners have heard this before, not to do anything different on that day. But still, inevitably कुछ तो अलग हो जाता है. So you have to safeguard against that. No new shoes, no new gels, no new warm-up exercises, nothing new based on the day before किसी ने कुछ बोल दिया या वहाँ किसी ने when you're in the group somebody said अरे मैंने तो इतना किया. Don't listen to anybody. You've done your own stuff, you stick to it. So that keeps you in a good mental frame of mind. See, the physical aspect is done.
Yeah.
On that day, there is nothing else you can do from a physical aspect. What you can do is work on your mental aspect because the Comrades or any ultra is so much more about the mind than your body. So if you can keep your mind calm, knowing that अब जो होगा वो देखा जाएगा, then you're okay.
Yeah. Fair. And also you did speak earlier about getting into peak training, right? And then of course we all follow a science of tapering down. How important is that, and what do you think is an
Extremely critical.
adequate
Extremely
period of
critical.
taper? Yeah. Okay.
Yeah. So everybody has their plan ready. They have the taper period also ready.
Yeah.
Right? Peak हुआ, उसके बाद that taper is necessary, absolutely necessary. The problem happens when you've not done pre-peak, if you've not done enough and you suddenly push the mileage and then something happens, then you are in trouble. So if you follow the plan properly and you do the taper and you do a bit of recovery towards the end and keep your body nice and supple to run for endurance, then you're good to go.
And then is that period a 2 week period, a 3 week period, or what is it? What do you think average works for everyone? 2 to 3
Generally
weeks?
about 2 weeks.
2 to 3 weeks. Yeah. Understood. So, Doctor, another point I want to discuss is over the years, I have seen and probably known and experienced around that people get injured, people get into injuries, and is just by anecdotal evidence. My hypothesis is that when you push faster, when you push harder, you become more injury prone because most of us are not athletes in our young age. Very few people would have done active sports in young age. So hence the risk of injury goes up as you push harder, as you want to run faster, as you want to go for PBs in every race. Is that the right hypothesis?
So in part, it is correct. Yes. obviously, if you're putting in the mileage, you are causing some amount of wear and tear in your joints and bones and muscles. But if you have not overtrained, if you're just following a proper plan of training, then provided that your strength is enough, that your muscles are not going to fatigue, and if you work on your flexibility and mobility, and like I said, this recovery, so dry needling, sports massage, taping if needed, if you are building in all of these things, then um, that may not be the case. The amount of mileage may not impact directly lead to an injury, provided all these things are taken care of. But of course, if you, in a short period of time, if you overtrain, then yes.
Because all of us are trying to find the right balance between what is my optimum speed at which I should run at. At the same time, I don't want to get injured and go on
Correct.
for for a long period of running career.
Correct. Exactly. So that balance is different for everybody. So they do have to understand.
Yeah, because
And strength training, you said once a week, but I would say even as much as twice a week might be necessary for comrades.
yeah, because yeah, so that I think that's becoming a challenge, probably at least for me. I'm sure it's for others as well because running. Most of us end up doing 3 to 4 days of running, and if you have to sacrifice something, you end up sacrificing the strength training
But
in a week, right?
that's precisely the problem.
Yeah. So, what your advice is? You should have at least 2 days of strength training. If you want to sacrifice for whatever reason one workout, that got to be the mileage, and not really strength training.
Not really the strength
Yeah,
training.
that's
Or you
that's
build another day in, or find a strength routine that you can do in bits and pieces. Break down the 40-minute into 20-minute chunks.
hmm. Understood. Fair. I would like. There are quite a few questions that have come up, Doctor, and also I think, guys, we would please put in your questions on the chat. What I'll now do is I'll ask Doctor each of that so that we can try to address most of your queries, and of course, we have another 10 to 15 minutes to address most of them. Doctor,
Okay.
one question I have is swimming for recovery.
Hmm. Yeah, it's
How
great.
is it helpful, valuable?
Yes. Yes. In fact, I often emphasize on cross training. The reason why I didn't bring it up today is because you have no time to cross train.
Uh,
So I would rather you do the strength training. But yes, swimming is, it actually uses a lot of the opposing muscles of running, and it is non-impact. So it creates a lot of recovery. It also is great for the mind. So excellent as a tool for recovery.
yeah. So we have fair one question from Sujata. She's
Hmm.
asking because it's an up run. What are the non-negotiable exercises that one must do?
Hmm. Great question. You have to do glute max and gluteus medius exercises. Um,
Glute max. Yeah.
Glute max and glute med exercises. So, with resistance bands, lying on the tummy exercises, your fire hydrants, your donkey kicks with resistance bands. Some of these, if you're doing in the gym, then your leg presses. These working on your glutes is non-negotiable.
Understood.
That's the
And there's a
one.
question. Sorry, there is a question on ice bath. Do you
Yeah.
recommend that?
Yeah, ice is a great recovery tool, but if you can find a ice tub, that's wonderful. Then definitely do it.
Hmm. Okay,
Uh,
but it is something that you would recommend if there is an infrastructure to get an ice bath. At what frequency would you suggest? Once a week or something like that, or long
so
run
it's a
days?
recovery phase. Yeah, recovery is once a week. So your recovery, your daily sleep, your mobility workouts, which is once a week at least. It can be yoga, it can be any kind of mobility workout that you have figured out for yourself. And ice. Ice is a big part of recovery also. So when you run, your muscles and joints are getting inflamed. Ice is going to reduce that inflammation very, very quickly. So ice bath works really well. You can also, if you don't have the infrastructure and want to go looking for infrastructure, you can do ice buckets. So just take the biggest bucket that you can find and fill it up with ice water and then dip. So at least your lower part of your body, your calves, your foot intrinsics, all of that recovers well.
Fair. There's a question on dry needling and cupping. Is there a choice? Would you recommend one over the other?
Dry needling.
Dry needling better than cupping. Okay. And any special advice for women above 50 who are attempting Comrades? That's a question from Sujata, of course.
Yes. Yes. So for women, one, we spoke about how anatomy matters. Please pay attention to what shoes because and this is again a good time to figure out if your shoes are correct. So for women, it more makes even more critical that you've gotten at least like one running assessment done to figure out your strengths and deficits. Um, for some reason, women do tend to get weak around the hip and pelvis area, and we know that the hip muscles drive your runs. Plus, because of the Q angle, the knees get overstrained a lot. And if your shoes are not correct, the base is not correct, then all the load is getting distributed right onto your knee and to your hip. So, getting a gait analysis done is a great first step for women to figure out where their muscle work needs to happen. So, they can do focused work, but fix your shoes now so that you can train in the correct shoes instead of the wrong shoes. So, these are a couple of advice. Also, for women, like I said, blood tests. When you do your blood test, check your magnesium level, check your electrolyte levels because that can drop pretty quickly in women. Your iron levels, please check as well. And keep these up to par. And hopefully if you are above 50, then you are already taking magnesium and iron. So if you're not, then you may need to speak to your nutritionist or to your gynac or somebody like an expert.
Understood. There's a another question on when you mentioned about foam rolling and stretching, right? On for recovery. Rolling first, foam rolling first and stretching later.
Yes.
Is that the sequence?
Yes. When we use it for recovery, that's the sequence to be followed. Because when you foam roll, you are loosening up the myofascia that's underneath the muscle.
Okay.
Okay. And then when you stretch the muscle, you will get more elongation of the muscle.
Understood. Okay, fair. And then, I mean, is there on a day when you're doing the foam rolling, you do up the whole leg, or is there some specific muscle, one muscle a day, something like that?
No,
Or it's
no,
fine?
no. You
It's
do
fine.
all the muscles. All the muscles you use in running, starting from your glutes down.
Understood. Fair. So, Doc, I mean, we've kind of really, at least I feel, covered a lot of aspects that at least were there in my mind and most of our minds. Is there something else that we have not spoken about in your experience, in your knowledge, we should know, understand some aspects that we haven't addressed?
I have made notes. Wait, I'm checking.
Okay, nice.
I did want to cover when you're going uphill. I did cover the muscles that get used, right? That might be a bit technical for people, but you should, as Comrades runners, you should know muscles. You should know. But when you go uphill, the strategy that you can use, one is because you're going uphill against gravity, your body weight will be slightly forward. So your normal running that you are doing on flats will not apply. What you're going to do is you're going to shift your body weight more on the forefoot. Okay, so what does that mean? Your glutes, all the pressure is going to go up to the glutes, which is why I said you work on your glutes. But along with that, making sure that your shoes are correct, which means that there is enough cushion throughout, especially in the forefoot, that also becomes critical. The other is stride length. If you're used to running with a certain stride length, remember that your stride lengths will be slightly smaller when you go uphill, and that's okay. In fact, runners who try to push, and we've seen this in Satara over and over, that when people going uphill, they try to push, cramp आता है या knee पे pressure आता है या lower back goes. Okay, so it's okay to take smaller strides when you're going uphill and pace yourself well and pay attention to your breathing. The other thing was arms. When you go uphill, also the tendency is to pick up the arms and do more arm stuff. So you don't want to waste energy doing more arm work. Try to keep your shoulders and arms as relaxed as possible so that you conserve some of that energy for the long haul that you have in front of you. So the up mein, the last few, so the 35 to 40 kilometers is when maximum muscle fatigue will hit. So make sure when you're going throughout up that you make sure you conserve stuff for there.
So you kind of, in a way, you're talking about energy management.
Energy
Right?
management, but also about muscle fatigue. There are two aspects. Now, one is your cardiovascular energy and also your muscles. So if you do long strides and you push, then your muscle fatigue will set in faster. Then you'll be in trouble at the last of the up.
So fair. Okay, understood. So one question in my mind, doctor, what is the right or the optimum heart rate beyond which one should not push, right,
So as
during
a rule
runs?
of thumb, it is 220 minus your age is the rule of thumb. But heart rate training, hopefully you guys are also doing some heart rate training runs, which your coach can help you figure out the safe zone for you to run in. So that again needs to be practiced now before in your peak, then you're pushing endurance and mileage. Uske pehle your heart rate should be fixed. So, but the bottom line is that that you don't want to go nearly as close to 220 minus your age.
Yeah. So if like 220, if I'm 45, 220 minus 45, beyond which I should really not push 175. Beyond 175 is not something that I should push. And all my runs, including if I'm doing intervals, if I'm doing tempo training, but I'm pushing harder, I
All
should
of
not
it.
be beyond 175.
Yes, that's an unsafe range for the heart to be in.
Yeah. So I then reduce the risk of, as we these days read a lot about cardiac arrest for while running, even at time to run. If I'm running below that safe in that safe zone and below that risk.
Not necessarily, because the heart is a muscle and there are a lot of factors that go into muscle health. So only that factor is not going to help.
Not
You
enough.
should have, yeah, it's not enough. Your sleep matters. There are a lot of factors. The stress matters. Um, Too many things go into that. So
So
that
it
is
is.
definitely heart rate training you must do. But that doesn't mean that if you've done that, that you're totally safe. You must have done your other tests and you should have been cleared and screened and follow things,
Yeah. So
everything that we've spoken about.
how important which tests should I definitely, or should a runner, distance runner, definitely do to check the health so that running doesn't aggravate stuff, and at what frequency? Is there something?
So an annual check with a cardiologist or somebody who can help you in that, or a stress test or heart rate monitoring test. These you can go in for once a year, like an annual, how you do your annual blood test. It should be part of that.
Understood. Okay. There are, I think, let me just check. There are There is a question on shock waves treatment. I'm not so sure what that means. Doctor, you have
We're
any?
talking about diathermy, shockwave diathermy. If that is the case, then it's not really useful at all.
Okay, okay. Understood. While running, when you're doing those distance running, is there something that is there anything specific exercise that we can do to relax or recover? Is the question.
I didn't understand the question. There are
No,
a
no. I
lot of
mean,
recovery tools.
uh, so someone is asking. It's like while I'm running, I'm doing a longer distance, 3 hours, 4 hours, 5 hours.
Oh,
Is there
during the
something?
run.
Yeah, I relax my hands. Is there something that I do, which just makes me more efficient and makes my
Hmm.
run easier?
Yes. So one is focusing on your breathing sometimes helps. So running is like meditation. Now you go
Yeah.
into some meditative state. But if you can bring yourself back and focus on your breathing, sometimes that helps. The other thing I find helps relax runners is if they focus on pushing their elbows backwards. So your shoulder blades, if you do like a squeeze, scapular retraction, it's called. So if you do some of that movement, it generally relaxes your upper body, and as a result, your breathing can improve, and that can help relax.
Understood. Fair. Somebody is asking about a massage gun. I don't know what a massage gun is,
Sure.
but how good is a
Yeah.
massage gun?
So, like a physio gun or a thera gun. So if some of you, if you know already, I'm a big fan of the foam roller. So I say nothing substitutes a foam roller. But if you must, then you can use a Theragun. But be careful that you're not hitting any bones or not too close to bones, because it's quite more powerful. The advantage of a foam roller is that you can tweak the amount of body pressure, you can tweak the angles, and you can do it as per your needs. So absolutely, it's okay to use a Theragun for sure. If you're not going to do the foam rolling, then you at least do this.
Hmm. There are those we don't get it in India, but in other countries we get those skin tights, right? Which kind of post long runs people recommend and wear it on the legs so that it kind of compresses the muscles. Yeah,
Compression, na? We get now
compression.
compression.
Yes. Yeah,
Yeah, yeah.
yeah. It is something that is good to have,
It's
good to
good
wear.
to have. Again, it's something that you have to try and test it if it works for you. I
Hmm.
don't think it is necessary and mandatory, but however, a lot of comrades runners prefer that also. So, if you want to look into that, maybe do a few runs now and figure out if it's for you. Don't wait
Yeah.
the end. But you get
Understood.
now compression socks, you get.
Yeah. Okay, fair. I think we have largely covered, doctor, and I think yeah, it's definitely helpful. I mean, it's helpful to me all that we have tried to cover and ask you, and I'm sure it is helpful to everyone there on the chat. And of course, we'll record it and I'll put it on YouTube for everyone to watch it later, or others who haven't been on this chat today. So thank you very much. Thanks a ton for doing this at a short notice, and hopefully we'll bump into each other at the runs and the races, and meet you. And I'll express my gratitude then as well. But thanks a ton for doing this for us, Doctor.
Absolutely my pleasure to be here. Thank you, Kashyap. Thank you, Sujata, I must say, for this as well. So, yeah, I'm very happy to be here. If anybody has any questions, they can reach out to me as well.
Yeah, I'll definitely share your contact details on our India Comrades group, and if people have anything any reason to reach out to you, I'm sure they will.
Great.
Thank you, Doctor.
Thank you. Thank
Thanks a
you.
lot.
Thanks.